Did you know that chronic stress could be the hidden reason behind high blood pressure, heart disease, or even heart attack or stroke? The connection is real, and today I'm going to show you how stress puts your heart at risk and what you can do about it. But first, my name is Dr. Erica Steele. If you're new to my channel, I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. All this month, we've been talking about how to keep healthy heart and healthy blood pressure. We do have a more expanded webinar that I did for you, completely complimentary. You can go ahead and click the link in the bio below. And what it will show you is about testing, if you're on medications, all about the different medications, side effects, interactions to look for, nutrient depletions, lots of good information, foods, all sorts of things. All right, so let's get to stress, right? So stress actually silently damages our body overall, but let's talk about specifically what it does with the heart. So it affects the heart because it increases cortisol, which we know is the stress hormone. And as it does that, it naturally is going to raise the blood pressure and then put damage or pressure on the arterial walls. And so the blood pressure actually spikes as a response to stress. So either sudden stress or then kind of that extended stress can really wear out those venous structures. So we definitely want to make sure that we keep a moderate blood pressure, not going too high and definitely not going too low. I know people want to focus just on the high, but if we keep it really low as well, sometimes it can be really healthy if you have cardiovascular conditioning, if you've been running, that sort of thing. But also too, if you have a lot of internalized stress or you've had trauma, you can also have a low blood pressure. So sometimes you want to do some training on that and start to elevate it if it drops too low, because you don't want to get dizzy or lightheaded. So when you have heart rate variability or poor heart rate variability, it actually leads to higher heart disease risk. So we really want to make sure that we keep a healthy arterial walls, we keep healthy blood, we keep a healthy heart. And so some of the ways that we can do that is manage our stress. So, we learn emotional coping mechanisms. We can learn how to communicate, build emotional intelligence, build self-awareness, all sorts of tools. I always like to ask my patients, what are your tools in your tool bag for stress and what do you go to? Because let's face it, life is going to be stressful and you can't always necessarily, call your therapist. I mean, you can, but people are not always accessible. And so sometimes you're going to have to depend upon yourself. In fact, I find most of the time depending on myself, number one, and then looking to my, support system, really just to be an additional support, but not be my primary source. All right. So another thing you can do is adaptogenic herbs. So holy basil, kava, chamomile, and just sitting and breathing with some herbs really can make a huge difference. Walking out in nature, disconnecting, journaling, practicing mindfulness, deep breathing, box breathing. There's all different tools. If you're interested in those tools, I have a lot of them in my 30 Days to Emotional Healing. It's a little brief course that I put together, but it is 30 days jam-packed. So even though it's brief, it's jam-packed because every single day it gives you one of the emotional coping tools that I've used over the years that have really helped me to just, deal with life and therefore help my organs and help my heart especially. So again, lots of goodies for you available. So go ahead and click the link in the bio and share, comment, and subscribe for more.